And you are live.
Okay. Good afternoon. This is a Health and Social Services Committee meeting. I think Sarah indicated that all members are present except Councilman Freeman. Is that correct, Sarah?
Correct.
Okay. With that said, we haven't had a meeting for a while, but do we have minutes from the last meeting, Sarah?
Yes, the last meeting was from April 5th.
Okay. May I have a motion to accept the minutes from that meeting, please?
So moved.
May I have a second?
Second.
It's been moved and seconded. All in favor?
Aye.
Aye.
Okay. Any opposed? The minutes have been approved. We don't have anything on old agenda. We have one item for today. If I can get my phone to cooperate. Is offered by Mayor Horgan and President Somerville, and we will add my name later. Ordinance repealing ordinance number 214-2020 passed July 13, 2020, which ordered that all persons in public places within the city of Akron wear a face covering, encouraging Akron residents to continue to follow CDC guidance and any applicable requirements from the Ohio Department of Health or individual businesses, industries, and make responsible personal decisions that will limit the spread of COVID-19 and declaring an emergency. Essentially, we passed an ordinance asking us to follow the science, and I think we've done that in Akron quite well. We invited Commissioner Donna Skoda, and I think, are you present, Donna?
Yes.
Okay. I would turn it over to you so you can kind of tell us where the science is leading us now so that we make sure that we're doing the right thing by repealing the face coverings.
Okay.
So welcome and thank you for coming.
Thank you. So what we're going to talk about is we're just going to kind of give you like a cliff notes, and then we can talk a little bit about science and why it's to this point. First of all, this governor announced on June 2nd, he was going to repeal all of his orders, which would have included the statewide mask, would have included any number of the orders, which is fine. I mean, the case counts are coming down. We now have vaccine. Vaccine is a far more effective weapon than is, quite frankly, a mask and anything else that we have right now. So the vaccine is where we need to focus our efforts. Where we're at, though, is CDC then came out and said that if you're fully vaccinated, you're good to go now, which isn't what the governor's order had said, which kind of caused like a firestorm of confusion for folks. So the bottom line is June 2nd, from what we know now, where I'm giving you this information without ever having seen the full order. The order is not out yet. So this is just what the governor has said on telephone calls and what we have read through the CDC and the press releases from the governor's office. So what it appears will happen is the governor has indicated that he will now follow CDC guidelines. All of his orders will be repealed on June 2nd. However, schools, healthcare, nursing homes, correctional facilities, there's a list, and we're not real sure all of the different kinds of places that are going to be included, but it's certain entities will not be able to not unmask at this point. They're going to keep those in place until we see where this virus goes. And as you remember, those were some of the areas hardest hit when it first came. So it almost makes sense that they're the last ones to come out of it as well, because they were at greatest risk. So what the science is telling us now is what they didn't know for a while was if in fact you are vaccinated, can you spread the virus? And it looks like now you have a very low transmission rate because you don't ever get sick enough, get enough viral load. So we know that the vaccine is very, very effective in keeping you from getting really sick. And it's also very effective against the variants. So individuals who do have vaccine breakthrough have not been really sick. So that, and there's been just a few numbers, like I think in Summit County, last time I looked, we had 15. There were 15 folks who had vaccine breakthrough, and none of them were really sick. So that's one side of the story. So our Board of Health on May 13th repealed our local mask order to coincide with the governor's orders. So we have lifted the local mask order effective, that was immediately. So that's off, but there still is in effect currently the state mask order. So what we foresee happening in the future is I don't think we want to incite and cause problems between vaccinated and unvaccinated individuals. So it really is a lot of the honor system, but the recommendation will remain that if you are unvaccinated or cannot take a vaccine, that you need to, you need to still wear a mask, socially distance, and protect yourself. Being in a place, if you are vaccinated with unvaccinated individuals, is very low risk to the vaccinated person. But the individual who is not vaccinated is at greater risk. So you are going to have to think about all of those people who can't take a vaccine or are too young to take a vaccine right now. So I think what you're going to see is, and plus there's going to be absolutely no enforcement of this. So even if you left your mask mandate in place, there would be no way to enforce it through state law, nothing. You're not even going to be able to do that. So it's going to be very difficult to tell who's vaccinated and who isn't vaccinated. I'd like to put all of our efforts into getting as many individuals as we can vaccinated and having people see the benefit of being vaccinated and that it really does give you protection. So I'll stop there, Linda, and then we can answer any questions that you might have.
Sure, I'd just like to kick it off, and certainly committee members, if you have questions, just raise your hand. And if I don't see it, I'll ask, I can put my gallery on, maybe I can see it, but I'll ask Sarah to let me know. So as you indicated, it's going to be an honor system. So people who are not vaccinated are going to have to make sure they take the precautions to wear face coverings. And those of us who have had the vaccinations, we are safer, but we are not 100% of anything. It's just that you may risk getting something, but you won't be as sick and you won't die. That's what it sounds like.
Yes.
So,
well, that's what the science is saying right now.
Right. Sarah, do you see any hands raised?
I don't see any at the moment.
Okay. Any council members with their hands raised?
None at the moment.
Okay. Well, Commissioner Scota, we appreciate you coming back and just keeping us informed and
you're welcome.
Following the science as best we can. This is probably going to be with us for a while as we struggle to find our way through it. But I think all in all, we've done extremely well in terms of wearing mask coverings and doing social distancing and just trying to do all the things that we have been told to do and do them well. So thank you very much for keeping us apprised.
You're welcome. You know, what we all need to think about is, though, how do we message the risk to people who aren't vaccinated? Because I think you still need to know your risk is out there. You know, we still have a lot of community spread. You still have youngsters that aren't vaccinated. So we have to really communicate that risk well to people that know it's not me that I'm worried about, it's you, because you stand the greater chance of still getting it. So that's a tough message.
Sure. Thank you so much. Are there
you're welcome. Thank you.
Sarah? Anybody got their hands raised here?
No, there are no hands raised.
Okay. Thank you so very much. That's the only thing we have for the committee today, unless there are other issues that anybody on the committee would like to talk about.
Did someone want to make a motion on this?
Oh, Thank you very much. We have to do that. May I have a motion to, we need to, I guess she's already put theirs in place and we're talking about going June 2nd, but I guess we have to next week. But would someone like to make a motion to accept a resolution with suspension of the rules or take time? Either way is fine with me. What would you like to do?
Madam Chair, I'd like to make a motion that we support the resolution with a favorable report and suspension of the rule.
Okay. Is there a second?
Second.
It's been moved and seconded that we approve this ordinance, this resolution with immediately with suspension of the rules. All in favor?
Aye.
Oppose? The motion carries. So tonight we will do this again. We will approve the resolution with suspension of the rules. I'll give it to the body for consideration. Thank you very much. Is there anything else to come before the committee? Hearing none, the committee is adjourned. Thank you very much.
Our next committee meeting will be the Budget and Finance Committee, and that will begin at 3 p.m. Those committee members are Freeman, Amobian, Malik, Baylor, and Lombardo. Again, that will be at 3 o'clock. So we'll stop the